Welcome to Pulmonary Rehab. I'm Carolyn, registered dietitian at Allen Hospital. I'm here to tell you about nutrition that can help you with your lung health. Some of the most common problems with getting enough nutrition with chronic lung disease are decreased appetite, difficulty chewing, dry mouth related to medications, and weight loss. Unfortunately, a decrease in good nutrition may contribute to poor lung function, inability to fight off infections, and decrease your overall physical strength. Some simple ways to help make sure you are eating enough: eating 5 to 6 small meals a day, or 3 small meals and 2 to 3 good healthy snacks throughout the day can help. Sometimes setting an alarm for every 3 hours to remind yourself to eat something can be very helpful until you can get into the routine. Seek out ways to easily prepare meals, such as using a slow cooker, batch cooking to allow for leftovers throughout the week, or use microwave cooking directions to reduce standing time in the kitchen. Selecting easy-to-chew foods would decrease fatigue of eating and reduce swallowing air while eating. Choose soft, well-cooked vegetables. Canned or soft ripe fruit, ground meats are some examples. Ways to avoid swallowing too much air while eating could be: avoid using straws, limit or avoid carbonated beverages, and remember to eat slowly and exhale when swallowing. Be aware that drinking very hot or very cold drinks may increase coughing spells. If you notice this may be a trigger for you, try drinking something at room temperature to reduce your frequency of coughing. Avoid laying down right after meals. This will allow for easier breathing after eating. Try to make sure you have an hour after your last meal or snack of the day to relax in a chair before going to bed. Lastly, many people with chronic lung disease require more calories to maintain their weight and often lose weight because they cannot eat enough. Others may have difficulty breathing due to being overweight. I will address ways to help both situations as we continue. How do you know how much is enough to eat? Good protein intake is essential for maintaining your muscle mass. The goal is 6 ounces a day. A 3-ounce portion is equal to the size of a deck of cards, as seen on the left. Other good protein sources include eggs, cheese, and peanut butter. Each portion on the right equals a 1-ounce portion of protein. Generally, a person needs approximately 8 cups of fluid a day. If you find you get full during meals, you may want to consume most of your fluids between meals. If you have been told by your physician to gain weight, choosing fluids that are good nutrition and calories are a must. Choose milk or juice. If you have been told to lose weight, choose water to drink or a beverage that is low in sugar or calorie-free. Adequate fiber can help prevent constipation. Trying to consume at least 3 servings of whole grains a day and 5 servings of fruits and vegetables with skin and/or seeds to increase your goal of 25 to 35 grams a day. Whole grain breads, brown rice instead of white rice, apples, carrots with the peels on, and nuts and seeds are great examples of high fiber foods. Please take note to increase your fiber intake slowly, adding an additional serving each week, and drink adequate fluids to avoid a bowel blockage. Limiting your sodium intake, or salt, can help reduce fluid accumulation around your heart, arms, and legs. Avoid canned vegetables and soups unless labeled as no added salt, and choose an herb substitute for salt instead of reaching for the salt shaker. Omega-3 fatty acids have anti-inflammatory properties to aid lung tissue. Good choices would be salmon, mackerel, herring, or trout. A good goal is having fish 1 to 2 times a week. Think rainbow. A rainbow of colors from fruits and vegetables during the week are all rich in antioxidants. Antioxidants have been found to improve lung function and immunity. Keeping yourself at a good weight is important for improving your ability to breathe and function at a higher level. If you have been told to lose weight, this may significantly improve your ability to breathe. Be conscious of your calorie intake, especially if you are on steroids. It may help to have multiple low-calorie foods to munch on if you are experiencing an increase in appetite while on steroids, such as prednisone or albuterol. Some good resources for you are checking out the website choosemyplate.gov. There are healthy tips available as well as ways to track your food intake and activity. You are also welcome to ask your pulmonary rehab nurse for a referral to speak with a registered dietitian one-on-one. If you have been told to gain weight, this is for you to maintain your strength. You are more likely burning more calories than you are eating, and this will lead to fat and, more importantly, muscle loss. Adding extra fat to foods will increase calories without having to eat more. Try adding olive oil, tub margarine, or nut butters to foods. Choose foods that are not light in calories, such as regular sour cream, instead of a lower calorie option. Also add a nutrition shake, such as Ensure or Boost, to your daily routine between meals to increase calories without having to eat so much. You are also welcome to speak with a dietitian. Just ask your pulmonary rehab nurse. In closing, remember eating a wide variety of foods that are low in salt and high in protein, as well as maintaining a healthy weight, will significantly improve your overall well-being. Have a great day.